So next, I'm going to introduce Dr. Armour Forse. He is a general and pediatric surgeon whose interest is in medical education and clinical and basic research. He has considerable experience in directing postgraduate and graduate programs in medical education, and he is a prolific researcher who has directed research laboratories conducting investigations in nutritional support, immunological and metabolic response to injury, the treatment of sepsis, the biology and treatment of morbid obesity, and clinical outcomes. His clinical interests are gastrointestinal surgery, including minimally invasive procedures and bariatric surgery. He has authored or co-authored more than 300 publications, books, chapters, and has performed more than 1,000 bariatric operations. He is an associate editor for both Obesity Surgery and Surgery for Obesity and Related Diseases, the two leading journals in bariatric surgery.
Good morning. You can hear me okay? So I understand you'd like to learn a little bit about becoming a doctor. Lots of rumors out there. So we're going to try to take you on the voyage, and along the way, talk a little bit about the voyage. Sometimes along the way, we're going to hit some of the areas that are controversial, and we'll try and sort you out through that. But the bottom line at the end of the day is we want you to understand that being a physician is a great job. It's a wonderful job, very rewarding in actually many, many ways. Sadly enough, it's going to take you some time to become a physician. This is kind of the roadmap. It can take up to 20 years if you include high school. College, and I quickly will comment that I think it's important to do something in college that really inspires you, but you do have to keep an eye out for what the prerequisites are, right? So obviously people that go into biology will hit most of the prerequisites for medical school, but if someone wants to go into arts, they could potentially run into a situation where they don't necessarily hit all the prerequisites if they don't plan right from the beginning, right? Medical school, I talk here about joint programs. It's very possible in medical school today to do joint degrees. And I'll add years. You then go to a residency. That can be a joint program, and fellowships. And then after that, you go into your practice. And it adds up to about 20 years. So it's important to let people know that, you know, that's the length it's going to take. This is me. I did the 20 years. I did zoology. That was kind of fun. It was, you know, you were studying animals, and by the way, most of us do fall into that category, right? So learning about all types of things that other animals do did give me a great background for going into medical school. Medical school, from my undergraduate, I got into research. I wanted to do research. Did med school. I then didn't do a dual program there, but I did the dual program as a resident, which is the other opportunity to do a dual program. So I got a PhD in experimental surgery to get my research background. Did a fellowship as a spin-off of the experimental work, and then went into practice. Well, do we need doctors? Oh, yeah, we need them. Go get them. There's two sets of numbers here, and there's a lot of back and forth about just how many we need. First thing to establish, it doesn't matter where you go, or what healthcare system you look at, or what country you look at, you need doctors. Doctors are a fundamental part of any healthcare system. Variations in the numbers because there's speculation that will change some of the ratios of physician assistants, nurse practitioners, and doctors, and that will change some of the requirements. But at the end of the day, the bottom line is we are going to be thousands of doctors out. A recent survey from the American Medical Association said in the next 2 years, 1 to 2 doctors out of 5 will stop practicing, which means that just moves the number more up than down. Reasons for that are multiple. We do have an aging workforce in physicians, and the pandemic did have a bit of an effect. So we need you to find them. Okay? And that many of the folks who want to look at medicine today are concerned, and we'll try and touch on some of the concerns. When does it happen? When do they start thinking about medicine? It's in high school. If you add up the statistics on the graph, there's about half of them sometime in high school, just before or during high school, decide they want to go into medicine. And a lot of them will get turned off because of misinformation, misguidance. It becomes evident that when we talk to some of the folks out there, the people trying to mentor them don't necessarily have all the information or all the correct information out there. So given the data that's here, recognize that you're going to play a major role in helping them out. And it's important, if you don't have the information, to reach out and help get the information for them to be guided. So to kind of decide how somebody would think about medicine and relate to it, we should probably ask the question is, what are the characteristics of physicians? So this is a set of surveys. We did them with physician, patients, colleagues, and administrators. And I'm not lining them up so you can't think particularly about why one group thinks one way or the other. But as you look through these adjectives, you'll see some similarities, right, into what people think a physician should be. And there are some differences between them. What do we think about being a physician, right? The compassion and empathy and those personal elements are a key part of it. And a lot of it has to do with the evolving relationship of the doctors and the patient. And the patients today want their doctors to be readily accessible, compassionate, empathic, and good communicators. And when I talk about communication, it's not what you all think, right? It's not this thing. It's not because you're really great at tic-tac-toe, whatever you call it, right? They want you to look, patients want you to look them in the eye and have a really meaningful conversation. Many of you may have gone to the doctor's office, right? You want that conversation, you want that relationship. And in a very short time, because we can't spend an hour with each patient, we only can spend a few minutes. I have to develop a relationship with you that you feel comfortable with me and will trust at the end of that visit when I tell you something that you need to do for your health, that you really want to do it. Unfortunately, that doesn't always work. And so what do people do when they leave the doctor's office? They immediately go to Dr. Google, right? Oh, I don't believe that. I don't think he's, check that out. Right. The other thing is I can't do it on my own. I can't practice medicine on my own. So I need to have people work with me to be able to deliver the health care and be effective and efficient. I need to be a good team player. And that's another important aspect of this, and it'll come back to us as we go through this. So William Osler, over 100 years ago, said, right, a good physician treats the disease, a great physician treats the patient with the disease. And that was over 100 years ago. And we keep bringing that back because of the importance of it. It's the person that you have to be able to deal with and learn to deal with. Okay, important question. So you want to be a doctor. Why? And for those who are interested in it, it's a great start to get them comfortable with answering that question. Because when you ask it the first time, they're going to actually feel you're assaulting them a bit. Because they haven't figured out the answer, right? But it's important to help walk them through that. And then it's important to actually get them comfortable with repeatedly asking that question of themselves. Because the voyage of preparing yourself for medical school is a learning experience. There's many things they will not have thought of that are important about answering in terms of, I really want to be a doctor? You know, people say, well, are you used to blood? It's not taking a little bit of blood anywhere, right? It's all the other aspects of being a doctor that they have to mentally get around to then finally answer that question. And you'll see at the end, because the process is a learning experience, a chance to learn about yourself. And that's very important. Very important because it prepares them for the application process. You think of the application process when they're interviewed, that question's asked? Yes. Come on, guys. Say it, you right? Yes. Right? In one form or the other. Okay, so let's take a look at the competencies for entering medical school. And this comes from the American Association of Medical Colleges, the competencies that are for medical school. You'll notice the first thing is the social culture. A fact that's being thrown around these days, which is kind of interesting, is that your zip code will dictate your health more than your genetic code. Do you know that? Your zip code may be more powerful than your genetic code and your health. What do you mean? Transportation, availability of healthcare, food services, etc., water services, electrical service, all that will have bearing on how people can take care of their health or not take care of their health. And so, since that's evolving and very important, it's important for people to really understand the concept of the social system and its relationship to health. The next one up is a diversity. You'll see that repeated several times. More and more and more that we have to learn to be able to deal with different people, different cultures. And that becomes important because you're really asking yourself, do you understand your ability to deal with other people? And that's a learning experience along the way. Your judgment, how you're affecting and learning how to alter your judgment, interacting effectively with people, there's the diversity again. The next one is basically a good understanding of biological systems and your ability to be able to understand them as they relate to disease. Now the next one is rather interesting because this one is becoming more and more important because healthcare systems and health don't want you to be doing a lot of subjective assessment of the situation. They want you to have an objective assessment. And that means that you're going to be given, or you're supposed to be getting data. Evidence-based medicine is a common term now. So you need to be able to go, find the evidence, analyze it, and make a decision about what evidence you're going to use in your recommendation to a patient. But you have to be able to demonstrate that you have that observational analytical skills. And that's something that can be started way back, even before high school, but certainly through high schools, get them comfortable with that. And then the latter part is you need to be able to demonstrate that you have that ability to apply those skills to biological systems. At the bottom of the slide, we talk about soft skills versus academic skills. There are people, unfortunately, when we've gone back and looked through students that have gone through high school and then gone off and not gone into medicine, who actually probably would have made great doctors. Why? Because they had that ability to have those relationships and communicate. But they really were told, you need to be a walking encyclopedia. You need to memorize things endlessly. And that's not true anymore, is it? Because knowledge is readily accessible. But using that knowledge and then relating that knowledge to the person is the important part. And so those who are really great in those soft skills would have made great doctors. You do need to have some of this, but those soft skills are important. For assessing a person's ability to enter medical school, we, those in the business, are having a problem in how to actually get a good assessment of those soft skills. And it's important to potentially talk a little bit about, as you recommend people that they need to mentor them and be associated with them, it's important for them to have the sense that somebody's got to talk to that. They will be interviewed, and the interview process is really getting more and more loaded about doing that assessment of those soft skills. But as you can look up and down these attributes, it's important for them to have a relationship with people who are going to write those letters that are going to be powerful enough to comment about what you see on the screen, okay? Johnny's a nice boy. He was so nice. He always sat in the front row of my class, and forget it, right? Those letters, no, not going to make it. But somebody who said that they worked with them for some time and that they have a relationship and that their communication with them was good, and they worked maybe in a clinic with them and met patients, and they were really good with patients and know how to talk with a diversity of patients. Honesty. Yep. It's important. We still have a problem. I have people who are fellows, that's that last line, who we've had some concerns about being honest. And it ties into the next line. Know yourself, know your skills and know what you can do, but also know what you don't know and what you can't do. Because that's the moment when you need to reach out and get help. And so being a great physician is somebody who knows that, oh, I'm beyond where I need to be and I need help. And I need to reach out and get that help to help. Teamwork, you need to know when you can be a leader, and you need to know when you should be a follower. Yes, there are times in the healthcare business when the nurse actually has the answer, not you. Or the respiratory therapist has the answer, not you. And I'll bet you all have people that you know that probably have trouble when somebody like the nurse says, "Doctor, I think you're doing it wrong." Oops, right? Not good. You know some of those personalities. What do you mean? Well, let's concentrate on the patient. Right? Yes. So that teamwork, really important. There's whole programs out there. Team Steps is a government program. There's your communication, which we talked about, not the social media. Respect, empathy, and really knowing how to be empathetic to somebody who's suffering. It's a big thing in medicine, right? That whole issue about suffering and how we deal with it. Problem solver, critical thinker. That's the issue about taking that data, information, organizing it, and knowing how to apply it. Solve the problem in a timely and effective way. Now here's a really big one. Time management. If you can help anybody going into any type of profession, is time management. How many people know students that have failed because time management was not there? Right? Come on, everybody. Oh, yeah, you're right, right? Oh. So if I was asking you to do anything with students around you, is really work on this. I have physicians in practice who are not successful because they haven't mastered that time management. You know, what do you mean? How can that? It can be. One of the things we'll talk about down here is life balance. How important is that today? Very important. Very important. We have an issue in healthcare because of the burnout. You've all heard it. You know we have shortages of healthcare professionals, not just docs, particularly nurses and other areas. And one of the problems when we tie those together is time management and life balance is how do you fit it all in? How many times you've heard that, right? What are you kidding? It's only 24 hours a day. What do you want me to do, right? No, I want you to get yourself organized and figure it out. You can't study all the time, can't work all the time, and you can't be in the gym all the time or out on the bike trail all the time. So how do I make that work? Time management. Really, really important. Lifelong learners. Every profession really has that. You can't be stagnant. You need to self-assess and you need to continue to learn. So these are some of the common parts, attributes that we think about a medical student. Extracurricular activities. Okay? So if you're somebody who wants to go into medicine, you really have to have had some experience in and around medicine or medical fields. This is the Rio Grande Valley, right? Okay. Our medical school here thinks particularly about your experiences in healthcare, and the focus, of course, is in patients who are in need, right? Because we have a lot of that in the valley. So volunteering in clinics and around hospitals and getting some interaction in healthcare is an example of how you can do that. Different work experiences and environments is good because you want to be able to say that you've had some example, some opportunity and diversity, right? Instead of the same place, you know. I worked in Uncle Jimmy's clinic for 6 summers. That's great, but it would have been good if you worked in somebody else's clinic a little bit with some diversity, right? Understand the nature of medical practice. This sounds a little too focused down, but it's true that people who have relatives in healthcare are better people in terms of having them go into healthcare because they know more about healthcare than other folks. And that's just the reality. Sorry, folks, let me just shut this off. Push the other one. Sorry. Technology, right? Can't live without it. Oh, yes, you can. And then evaluate your willingness to work with other people. That's getting to know yourself, and that's very important. Is how well do you feel about actually giving something out, sacrificing of yourself to other people? And not everybody who actually asks that question or develops an experience that can really answer that question for them. And the life balance. So when you interview, I want you to really be able to tell me that you actually applied it. What do you like to do? Well, I love to go, I love canoeing. Great. What's the last canoe trip you did? Well, I have a canoe. I see. Yeah. There was a survey was done of actually college students, and they asked them experiences they had. And it was amazing. These kids were just, it was incredible, all these experiences they had. So they brought them in and interviewed them. And they said, it says here, you climbed a mountain, it was great. What mountain did you climb? K2. Really? How did you organize that? Well, I got on the video game. I say, you race cars. Oh yeah, I got on the video game. And so, believe it or not, answering these questions, to them, they had all these life experiences because they had done it all on these video games. So, once you get kind of flushed through that, we realized the true life experiences were actually very few. Many of them hadn't even got out of the house, sadly enough. Life balance, really important. And another thing I think that needs to happen in schools and high schools is to talk about that, again, the importance of it. We are struggling in healthcare because people are trying to retrofit this in. And we're particularly interested in hearing how you've got that done as an applicant to medical school, because it sets the stage for how you're going to do it through the rest of your training and eventually your professional career. So what did you do this summer? Okay, here's the answers. First one, healthcare field activity, right? So that's all types of opportunities out there. The next one is MCAT preparation. It's an exam you have to take to get in to apply to medical school. Laboratory research apprenticeship. Dr. Rao, I'm sure, would be happy to have people, right? Yes, sir. Remember what we talked about, the analytical part? That was important. So getting into healthcare and getting yourself an opportunity to do something in a research lab kind of gets you in those two areas, right? I'm into healthcare, and I'm learning a bit about how to analyze data. They do have to do a little work about the job and be careful. There are some lab jobs where all you're doing is taking care of the rats. You feed the rats, you clean the rats. You feed the rats, you clean the rats. Okay, you get to work in the lab, that's okay. But you actually need the other part, which is I got to sit with the research team, got to talk about the data, hear the data. Of course, the real good stuff is if you actually can get involved in the project. The rest of it is really makeup for people particularly that don't have all the coursework that they need to get into school. Okay, MCATs. Are they important? What does the slide indicate? Yes, yes, and yes. A lot of the people around the application process, they kind of lowball it. You know, yes, we want your MCAT, but it's not the be-all and end-all. No, it's not the. Oftentimes they say it's not the soul. Of course, it's not the soul. But education is changing in many, many areas. And as a result, we need something that's an equalizer. Because we know the schools and the school systems are different. MCATs is one of those, okay? So somebody says, oh, they're not important. What does translate that answer? They're very important, okay? Don't let them fool you on that. And look at the bottom line. You don't want to be sitting there as an applicant to medical school trying to explain why you didn't do well on the MCATs. Right? You want to be talking on positive things. You want to be talking about what I did, the summer courses or summer research and all those, and my life balance and all that. But if this score isn't quite where it's supposed to be, then you're having problems because you're going to end up having to explain it. So the exam, it tries to hit on some of the areas that we think were important. You'll see the CARS, which is the reading and reasoning part, which the critical analysis, which we talked about again, being able to problem solve. The psychology, which is important too. So again, tending to look at the student from those perspectives, which we said are important in terms of somebody getting into medical school. So average about 500 people that are getting into medical school are on this side. How long is the exam? 6 hours. How many people have sat through a 6-hour exam in high school? Yeah, right. Do you get the idea? Yeah, I got to prepare for this. In fairness to them, they'll be confused a bit because they're going to hear it's not so important. Look, you got to go through a 6-hour exam, and it's going to hit these areas, and take some courses, and get time to do some practices, and do that. The people that do that are able to land themselves in those competitive scores. Oh yeah. There's all of medicine right there for you, right? If you did 128 sessions, you got it, right? You know everything about medicine. So number one, these guys screwed up, excuse my French, most people's ideas about medicine, right? There was a program called LA Law. I don't know if you know about that program. It was a long time ago. They did some surveys around that, and when LA Law came out, the number of applicants to law school nearly doubled. But when they did the interviews, they realized, oh my Lord, these applicants are so messed up in what they think law is really about, right? Oh, it's dating, it's going out, it's great, all these exciting court cases, you know, you can joke around in court, you know, and all this stuff. It's like, sorry kids, it's endless hours of studying, and you had to get them down to earth. What's the other problem here? Oh, come on, it's right in front of you. They're all male, and they're all white. Sorry, guys. Yeah. And that messed us up, too, because people thought you got to be a doctor, right? No chance, right? Not true. Actually, more and more percentages of people are And what's underrepresented is a general term. But as you go down there, you'll see there's significant increases, and there's a real requirement for medical schools to fix this problem. The bottom line is the shocker, perhaps, for most people. It's 50% women now, medical schools. 50%. Actually, a little more, 51, 52% are women in the schools. It's like in your role, so it's not just a little oops on the curve, it's a real fact. Two school systems are out there, just a quick comment about them. The allopathic and the osteopathic. Over time, these schooling systems and their curriculums have really become fairly comparable. Allopathic people tend to go into specialty medicine and have that in their mind when they look for that school. Osteopathic people tend to be more focused on preventive medicine and primary care, just generally speaking. There is a little bit of additional work. It's the osteopathic manipulative treatment that is built into the curriculum. They get about 40 hours of that additional work, but the rest of their curriculum and training is very similar to the allopathic. So certainly I think if you're trying to advise somebody, if there's really a big interest in primary care and preventive medicine, then this is not a bad direction to send them, and it's not any less in terms of training. Whereas somebody wants to be, a brain surgeon, well, okay, probably more along the allopathic. Know your schools, and when people want to come and talk to you about the schools, you got to dig into some details. This is UTRGV, first class in, most recent class in. The mandate for this school was to teach people here in the valley, and the pressure was on them to do so. And you can see, right? The breakdown, you can actually see the counties and the breakdown there. What's the male-female ratio here? Seeing the national trend? Yep, the national trend is here. Okay, what's the average MCAT score? There it is, 508 on that side of the curve, and the average GPA 3.5. Your data is readily available. The disadvantage to the new system in the fact that they're doing it online is that people oftentimes apply to 50 medical schools, right? I just tick off the boxes, right? I don't have to travel, it's all going to be online. But it's really important if you're applying to my school, that you really know about my school. People really sink in the interview when they can't answer simple questions like, where do most of the students in our school come from? Well, if you don't know that, it's the focus, Texas or outside of Texas? It's Texas, right? It has to a little bit mandate for the funding for the school. What's the focus towards the training program here is for the community, right? The underserved. We want to hear what you think about that, what this school is doing towards that. You'll see in the schools they take the kids from, that's not really having a bearing. It's more on that individual's interest here in its relationship to the Rio Grande Valley. As opposed to, so, what's the focus here? High-powered academic people? Yeah, the answer is yes, right on the screen, right? I got Nobel laureates, I got thousands of these guys who are driven to, what's the bottom line here? Publish or perish. Yes, I spent a few wonderful years at Harvard Medical School, and that's exactly what it is. I remember we interviewed one woman. We asked her, this is going to be a tough school. Do you think you could make it? She said, well, our family had to leave Vietnam, swam to a boat, took the boat, had to go to school somewhere, had to go to college in Germany, had to do some more college in America, And, you know, at the end of the day, could she do it? Yeah, no question, right? Incredible stories about people who had got through a lot in their lives. So if somebody wants to apply to a school like this, you want to lay the facts out there, because this is a place that you're going to go that's going to be a real challenge. And this is not for everybody. That's just the reality, right? Sometimes people think this is the place for them, but you really have to get them to understand what this is about. Harvard Medical School does not want students leaving their Harvard Medical School without having presented themselves, having completed this type of training. And you'll notice the number who are in a dual program, MD, PhDs. That's can be up to a 6-year program, focusing clearly on science and being researchers. By the way, look at the tuition and fees, $70,000. They do have a program with about $35,000 for scholarships. So that brings us to debt. A lot of people get turned off about this whole voyage because at the end of the day, it's kind of expensive. This is the UT system, tuition and fees. That's not including boarding. And no, they don't allow you to pitch a tent on front of the school for 3 or 4 years. Somebody has to pay for the boarding. This is the average annual cost of medical school, and you see it's gone up. Now, there is a big push, because a lot of these medical schools are tied to universities, and some question that's being asked in American universities is, do we really need the football team? Really? Yeah. Do we really need all these additional buildings? Do we all need this additional cost? How much of that's driving this? You know, can we drop the cost because we can get rid of some of the other things? Because that graph is going in the wrong direction. Here's the debt after medical school. That's, I think it was, I got you 218. 220 and 221 are about the same. It's about $220,000. All right, so now everybody's really depressed, right? Hey, Dad, I need another check. Okay, so that's one part of it. But the next part of it is getting rid of that debt. Maybe not talked about as much. And probably a good thing to learn about how to carry debt and to deal with debt. So this survey actually showed that within a few years, most of the people have eliminated their medical school debt. So learning how to handle that debt and realizing that the world that you're going to enter will allow you fairly quickly to eliminate the debt is an important part of this. Public service loan forgiveness is a program that's out there. People can put it over 10 years, but almost a third of the people were doing that to get rid of their debt. Another almost a quarter are getting rid of it within 5 years. And that's not a terrible length of time, particularly as we'll see on the road. So there is debt. You have to learn how to handle the debt, where the finances are coming from. But the news is that in healthcare, as a physician, you do have an opportunity to pay that debt off in a reasonable time. That's provided you don't want the Porsche the first day you're out of medical school, right? Yeah. Oh, come on, I put 4 years of hard work in, don't I deserve it? You know, a financial officer, no. We can wait for a few years on that. Okay, combined degrees. There are more and more of these combined degrees going out. Of focus point at the beginning were PhDs for people who want to do research. But there are people who are interested in the business of medicine, the people who are interested in education, also law, and public health. Yes, people are interested in these areas, they're beneficial. Certainly for myself, after I graduated, the doctorate degree helped me with my research lab. When I was applying for grants and funding, and people looking at me as a researcher as well as a physician, having that additional degree was an asset. If you want to be an administrator in healthcare, having an MBA or program like that helps. They believe that additional training really makes a difference. It's a short-term sacrifice, though. It really is a sacrifice. You will have to give up additional time to make that work. And if you think time management was an issue, now it's really an issue, right? People who are going to be successful with this and making sure you have that life balance. There are other backgrounds out there. We've had physicians who have come from nursing, pharmacy, psychology, ministry, engineering. Interestingly, a number of systems out there that are training people, particularly in research and looking again at data and data analysis, like the background from people from engineering. I think that that's pretty good. And a number of research groups are focusing on those types of individuals. Okay, so we finished medical school. The next thing we're going to do is a residency. Perhaps the bottom line is a good starting point. Is Dr. William Halstead, who came up with this idea that people would actually do years of training with physicians who are specialists in the hospital. And the word resident is because they used to live in the hospital. They still do. There's limited hours, but the idea is you spend your time there and you're working with a specialist to be trained more in that specialty. The curriculums for this are designed related to the fact that people will take board exams, and there's an agency, the ACGME, that is the agency that oversees these programs and gets them to be accredited. So the idea is I'm going to do a residency after my medical school and train in an area of specialty, and family medicine, primary care are considered the specialties as well. The Board of Specialists, the American Board of Medical Specialists, are the ones who work with the curriculums and the ACGME to make sure that the curriculum you have in that residency allows you then to sit for these board exams, which we'll talk about shortly. When does this happen? Well, it can happen all the way back to high school. People could say, I always want to be a cardiologist, and so they work their way through. But there's a fair number that enter medical school and they're not sure about the specialty. That's not a problem. Try and coach people that get nervous about that. It's not a problem. You may change your mind several times in medical school. And it's usually related to something like this. You've had an experience where you take care of a really, really challenging and cool patient situation. You get with a mentor, or you do a rotation, like a rotation in psychiatry, and you never thought you want to be a psychiatrist, but after that rotation in psychiatry, you go, this is it. This is what I want to be. So people don't have to worry if they don't have it. It can happen appropriately. The last one is really important. Choice should be driven by passion for that specialty. When people have tried to rationalize themselves in it, survey says they're not happy, they don't last very long in those areas, they have some trouble. So particularly in healthcare, it's got to be there, right? It's got to have that passion. That's what's going to back you up at 2 o'clock in the morning when you're dealing with a really sick patient. Okay? All right. Yes, you get paid. Here you go. So it's the beginning. Usually you don't have the types of dollars and cents that are going to pay off your debt, but some people start to pay it off. You can get loan forgiveness through this time, as we talked about. And so you, again, have to know your situation, know that debt situation, and figure it out. So you have to pay attention to it. There's Texas, South. So it is adjusted by the cost of living. So if you haven't figured that out, West Coast and Northeast a little more expensive. This is what a PGY first-year resident will earn. Each year, the incremental increase in their salary. Characteristics of a good resident. Some people say a slave. Not true, not true. Yes, they do have to spend time running around and doing things, but in this day and age, it's usually done within a very constructed curriculum and direction to go. Characteristics are pretty similar, aren't they, to what we saw about a doctor, right, physician? Program directors, those are the guys who run their programs. Look at time management and efficiency popping up again. Team player, need to take and be a leader when they need to be. There's the honesty and trustworthy up top. Independent learner, I don't want to have to, at this stage of the game, babysit you to learn. You need to figure out what you need to learn, and you need to figure out when you need to get it and learn it and use it. After your residency, you go to a fellowship. Not everybody. So when I finish my residency, for example, I can go into practice as a family medicine, general surgeon. I am trained up. But for those who want a further subspecialty, they will then go on to a fellowship. So I gave you an example. Somebody who would go into internal medicine and be boarded in internal medicine can then go in cardiology and then in interventional. So it can be 2 layers of a fellowship training. They all lead to board exams and certification. It's a time when people really gain a lot of experience in that area that they're wanting to have an interest in. By this time, you need to be a really, really good learner, right? How many years have you spent already figuring out how to learn, right? So the expectation is you're really going to be a big sponge. You're going to really pick up the specialty. Characteristics are similar to residents. They have to learn at a fast pace, really get it up, and to add to the specialty field. We often suggest if they've done all the other training at one center, that for the fellowship they go away to another center so they can learn the different style of medicine and the different style of training that would be present. So if you do a lot of work here, you might go to the Northeast or to the West Coast to do this fellowship training. And then you get to do this, the board exams, and you hear about people being board certified. So after their training, they're board eligible for a number of years. During that time, they can sit for these exams. People see this as kind of your good housekeeping seal of approval that this person is really qualified to do their specialty, right? So they do have to do the exams. The public are learning that seeing that people are board certified is that stamp of approval. And healthcare systems have learned that the people who are board certified really provide quality to their healthcare systems. They have actually helped to reduce costs, and they also help to reduce malpractice. The boards require you to get certified and then to maintain your certification. So we'll hear people talk about maintenance of certification. That's a program where throughout the year they are constantly updating themselves, okay, maintenance of certification, or recertification, which after a certain number of years they then sit for a re-exam. So it's kind of a way for us to give that, as I say, approval that you're maintaining yourself and you're keeping yourself up to date. Well, well, well. How much do you make? Students want to know that, right? So a lot of controversy, a lot of discussions, a lot of back and forth about what's going to happen to physician reimbursement. There are more complexities to it. You're being oftentimes rewarded on what's called work RVUs, is the number of hours I spend working, or particularly the number of cases I do. But more of the reimbursement is now tied to quality. I want to know how good your medicine is. If your medicine is not good enough, I'm going to not give you the bonuses that are tied into it. Outcomes, I want to know that you're really doing good, safe medicine. The one that's missing is the one that earns the most. What's missing? Neurosurgeon, $650,000. Yeah, so the person who puts that drill on the side of your head and starts drilling, you want them to do a good job, right? Yeah. So quality of life, etc., that goes along with this is part of the reward. And will it be changing a great deal? The sense is that probably not, with the shortages that are out there. They're going to be continue towards reimbursing people. So not a big concern. My colleagues would shoot me right now for saying that. But that's the reality in our society. One thing that keeps coming up is, what happens if we go to a single payer? Let's do socialized medicine, right? Well, that happened up in Canada. And these numbers are not too different to what we see in Canada in their socialized system in North America. Okay, so you enter the workforce. The most important thing I keep emphasizing to people as they go through their training is learn about the business of medicine. The people who go into practice oftentimes are confused about things because they haven't really kept up with the business of medicine. It's very important. It's going to play a major role in their practices. 70% of our graduates now, though, will sign up to partnerships or to corporations. And part of it is because they don't have a good sense of everything that's down below, they just turn it over to the corporations to do it for them. And then later on, they sometimes get frustrated because the corporations are telling them what to do, and they don't like that so much. 30% of those who have kind of figured it out and want to be independent will go into independent practices. But that guy or gal in the office that puts up the shingle out there by themselves is somewhat of a dying breed. We see it more in the rural areas. There is increased regulation. And large part of that is because people have not done a good job in healthcare in controlling it and controlling the cost. So there are now surveys that patients will fill out and provide feedback to how their experience was. And it's called HCAPs. You can look them up. You'll be shocked at what questions are asked. Like, did your doctor talk to you? Was your experience in the hospital good? Was the food good? Was it quiet? Did you like it? Well, wait a minute, did you cure my disease? Not on the questions. It's not on the questions. It's the experience. So healthcare has to learn about that. Increased technology. Well, we big push right on telemedicine. You get a private practice person going out there and you suddenly have to dial in telemedicine into your office. Right? Who's dialing that in? Why, I don't know. I have a stethoscope, right? But no, that's the future. And electronic medical records. You have to control the cost. This is out there now. Public reported data. Yep. You can go out there and get data about your doc and the system they work in. And then this whole issue that's on the radar about trying to control the cost, and certainly this question, do we go as a single payer? Sadly enough, healthcare systems, or particularly countries that have single payer systems, have better healthcare metrics than we do, if you've seen that data. So pressure on us to fix that problem. So when you start your practice, these are issues that are facing you. You really need to be thinking about them. You have to deliver safe medicine, effective medicine, patient-centered. Patients want to play a role in their health care. They want to make decisions with you. They just don't want to be sitting there and being told what's going on. We talked about team-based, timely. How many people are getting upset because of the wait when they go to the doctor's office? Yeah, come on, right? How long do you wait in the office before you look at your watch? Yeah. 2 minutes, okay, where is he? What's going on? That's right. I want it now. I want it now, right? Efficient, we talked about, and of course, the big issue about equality and the issues about the social economic status. Changes in healthcare. As we talked about at the top end, if you talk to hospital CEOs, they're very much into, look, I need the docs, and they need to understand data, and they need to understand how to analyze it and use it. So they put a big pressure on their system to generate the data. Dr. Forse, your patients are in the hospital 2.68 days. We want you to have them in there 2.5 days. Well, is that statistically significant? What do I do? How do I use that data to be able to work with that hospital and their CEO? We can't emphasize this enough. Patients want to be part of the healthcare system, and particularly about their healthcare. And then the quality metrics, that's the next paragraph. That's the reality. People want quality medicine. I don't care if you saw 50 patients today. You saw me. And I want the best for me, right? Me. That's it. And then the last one, medical education is working very hard to make adjustments in the educational fields so that all the things we've talked about are tied into the educational process. So again, people who are interested in going into medicine as a physician, as we take what we got here and go back to the front end, we want them to learn right from the very beginning of their interest in healthcare about the things we talked about. It makes them better prepared and better rounded in terms of being a physician. Multiple opportunities. It's a long trip to get to be a doctor. It's important to enjoy the voyage as you go along, and not just the end. Because each one of these steps and each one of these opportunities was unique on its own. And these are all the things I got to do as you go through it, and other people can do too. You can actually practice medicine, practice my surgery, work as a scientist, be an inventor. We actually have 13 patents on things that we developed along our way. Research labs, entrepreneur, we developed a business, private business, but we also developed our offices and ran them as businesses too. So learning about being an entrepreneur. I've done some education along the way. Public health, yes, worked with communities and trying to improve themselves. Particularly my area was obesity, which you heard. So we've worked very hard with communities trying and deal with that epidemic. We have done things a lot with law and legislatures. We actually are working with a group of legislators right now, and there's a number of legislators who are physicians. You check that out. In terms of trying to change some rules and some of the government towards improving our healthcare system. It's a challenging but rewarding life. There is a source book. This is the Association of American Medical Colleges. This is their 2021 book. I'm not trying to sell you something, but it is a resource book you can use to help you. Recommendation to them, to anybody, remember, this is the home of who? The brave, right? Fortune favors the brave. So tell them, be brave, be confident, follow your dreams. Thank you. Open for questions, is that right? Monica, am I open for questions? Okay. All right. They're all shy. Right. Do they have a microphone? Here, you want this one, Monica? Monica?
Oh, sure. I'll do that.
No, that's okay. You got that side. She's got that side. You're good.
Just really quick. On the, you were going over the allopathic and the what was it?
Osteopathic.
On the osteopathic DOs, do they prescribe medicine that they would prescribe?
Yep. Just the same as an allopathic. Everything is the same. Actually, the curriculums are like this. The postgraduate training for those schools is identical now, okay? It overlaps. So the only difference is they're a little more focused on preventive, the holistic approach to patients, and they get a little bit of that massaging. So, you know, oh yeah, we all need a little bit of that, right? I get the 40 hours in. Yes, ma'am, here we go.
This is more on a personal level, but
How personal?
along the
How
way,
personal?
along the way, what was it that,
Along the way, you know, to where you are now, what was it that was the hardest for you to manage, or that was hardest for you to?
It's a great question. So it's the patient experiences that are the hardest, right? First time that you are with somebody and they die, right? That you're going to have the lecture, you're going to have all the ideas, but there you are. And you need to be able to figure out how to deal with that because, again, that's an experience. It's an important experience, but you need to personally understand how to deal with that. I wanted to be a surgeon. We were on the cardiovascular service of peds, and we had a 7-year-old boy come in. He had tetralogy, it's a cardiac problem, and they did an early operation to allow him to survive to 7. But then we had to have him come in, and the surgeon basically looks at him and says, he needs this other operation. He doesn't get it, he dies. We do the surgery 50-50. Parents say, yes, let's do it. We did it. 3 days later, he was dead. Have to learn how to deal with that. That's the hard part.
Just a quick question. The homeopathic medicine, insurances sometimes don't want to cover that, correct?
You're talking about the...
Well, let's say natural, like the whole body, changing the way you eat.
Yes, so yes, insurance policies have all types of, what's acceptable and what's not acceptable. But that affects us all through our medicine, unfortunately. You just have to know about your policies. And if that's an important part of your health care, when you're signing up for policies, that little stuff at the bottom called the really fine print, read it. Read it. And if you don't understand it, get somebody to explain it to you, because sometimes it's really difficult, right?
Because even the LASIK eye surgery,
Yes.
sometimes they don't want it's considered cosmetic, but it's a need. And insurance is just rather not.
So the next time you want to see where we have a major problem in healthcare in the United States, look at what the CEO of Blue Cross Blue Shield earns. No, just look. It's public. It's there. They're earning millions of dollars, and they get a bonus for millions of dollars. And is there anybody here from the insurance? Look out. But they take money in, and they pay money out. They're a middleman. And we have a problem with that, and that's a country problem. And they're politically very active, and same as the hospitals. And so this is a lot of the additional monies that we have in our healthcare system that we somehow have to get control on, right? Somebody has to pay for it, yes, but again, we need to figure out where we can contain the costs. Yes?
Good morning, doctor. So what is the biggest challenge of being a doctor?
The biggest challenge? For me right now, it's honestly, all the way through, is learning the life balance. That's my biggest challenge. So if it's great, we have to keep ourselves healthy, right? Okay, so where do I get to do that? I show up at the hospital at 6 in the morning, and most nights I'm going home at 9. And that's because I have a lot of pieces to do that. My administrator will go by the office, and I've got one of those stretch bands. 1 o'clock. What's wrong? You okay? Yeah, I got to get the exercise. But so life balance is probably the biggest challenge. And that's why I emphasize it's really important at the front end. You guys teach them. This is the time to teach them. There's great little tricks you can do in class to teach people how to balance the time, right? Yeah, you guys need to work on that. My advice. I'm not telling you what to do. Together, right? We're working together. The problem is you brought lunch in. They all know lunch is back there now. All right.
We still have that, of course.
All right. Thank you all very much. It was a pleasure.